Now let's dive deep into this big LGBTQ story for today. I'm Greg Shapiro, and let's square up health. Trump's HIV cuts, a dangerous setback in the battle for health. In a move health experts warn could undo decades of progress in HIV prevention, the Trump administration is allegedly preparing to eliminate all federal funding for domestic HIV programs. The decision, which could be announced any time in the coming days, would shut down the Centers for Disease Control and Prevention's HIV Prevention Division. This will halt all federally funded efforts. Jirair Ratevosian, a global health expert at Yale University, said, quote, "This is a dangerous move. Putting prevention programs on hold today means paying a much higher price tomorrow in lives, economic stability, and public health," end quote. The cuts, which are part of a broader restructuring effort, would have severe consequences for organizations like the LGBT support centers, which rely on federal funding to offer HIV testing, pre-exposure prophylaxis, and linkage treatment. Experts argue that halting HIV prevention now, at a time when the U.S. is on the brink of ending the epidemic, risks reversing hard-won progress. Well, this is just the latest example of Trump's mission to undo progress achieved by previous administrations because he's so jealous that anyone did something successfully. Unfortunately, this is also one that affects so many in our community. Yeah. But 47 doesn't care. He's on his unstoppable revenge mission, no matter the cost and the lives lost.
Yeah. Right?
Yeah.
Vaughn, undoing decades of progress.
Right.
How does that wash over you?
Well, it's interesting because we knew this was coming. We heard of it was coming as rumors, and obviously it happened. There's food for thought, and that is, I just came back from the HIV Cure Academy that I went to, but the discussion has been why give, and I've said this when they said insurance was going to be covering PrEP, and I'm like, for how long? I mean, I remember us talking about that going, really? Is it going to be free? And my initial take is they're looking at it as we need to take care of the people who are living with HIV and get them virally suppressed, to be focused on that versus paying for medication to not get something. Right or wrong, but I think they're looking at, I think what we're going to see is more focus on, I'd like to think, on people who are living with HIV to get those individuals virally suppressed, because that's what's really going to end the epidemic. It's not going to be PrEP that ends the epidemic. It's going to be viral suppression.
But at the same time, there's all of these programs, regardless of what end it is has a target on their ass.
Yeah.
Because I know in past conversation with other anchors who are all in the healthcare community that the biggest portion of PrEP also is aimed at people of color and straight people.
Right.
Yeah.
Yep.
And the biggest growth, especially in South Florida, is in the people of color and straight people.
Well, we're number one. We're number one in the country down here in South Florida, and Black women are number one.
Right.
Okay, and people forget that straight people also get HIV/AIDS. It's not just a homosexual disease.
Right. And that's just like cutting funding for children's cancer treatments, or for cutting funding in West Virginia to stop drug issues. It just makes zero sense.
When you talk about and you bring in race into the conversation, then that's where DEI steps in, right? That's where they look at it and go, see, that's why we're not doing this. Is because
but preventative health is so important.
It is.
You know what I mean? And this country does nothing for it, which is why they don't want people taking Manjaro, right? Because God forbid you get skinny and then you have no more high blood pressure and you don't have all these other ailments that you had before, right?
Exactly.
So same thing. Like we do also have to take care of the new transmissions and get this education is finally getting to people. Women are finally understanding that they can take PEP and PrEP too, you know? I mean, and we're going to undo all that shit now.
Well, and I think back, and I keep thinking back to PrEP originally, and how, we had one of our leading healthcare communities took out this gigantic ad in the New York Times saying, when you start PrEP, you're going to increase your risk of STIs. Because that means everybody's eliminating condoms. They're
Right.
eliminating
Right.
that risky,
That's right.
what they try to call that risky sexual behavior because they're on PrEP. So therefore, they don't have to worry about it. And
Yeah.
it's like there's so much more to worry about than
Yes.
just HIV, though.
Well, and the other thing that also has me worried is like, they're erasing us and information and education
Yes.
from all kinds of outlets, right? So
Absolutely.
now on CDC, we don't even exist,
Right.
right? But for how about someone that wants to find out? You know what I mean? I might have been exposed or my partner is exposed. Let me try to get the right facts about HIV and AIDS.
Right.
And they go to the CDC and there's nothing there for them
No,
anymore.
right. And that's where they need to build those accountabilities and being tied into medical care. They've got, and then that's where we see a lot of problems. People who live with HIV, they say are going to live longer. Why? Because they're in medical care. They're seeing their doctors every 3 months.
Yep.
Most men, and I'll say men, if they're not living with HIV, they're not seeing their doctors until, okay, there's something.
So they have to.
There's a problem.
Right, or I'm on my way to the emergency room, and it's like, oh, I've got a heart problem. I got to get a stent. I've got to.
Yeah.
That's when they start. Oh, I wake up and take care of their health, and that's we need them to start taking care of their health now.
Yeah, definitely.
yeah.
For sure. All right, well, there's going to be a lot more
There
to this
is.
story coming
There's
up.
more
all right?
coming, I'm sure.
There is always something taken away, brought back, information, misinformation. So we try our best to make sure that you get the correct information so you know what to do with it, right? Education is power. And that's what we need to, continue to let people know that there's still sources and places to get correct information.
Yes.
Okay. So that is the big LGBTQ story for today. There is no other queer nonprofit media platform like